Good morning, ladies and gentlemen. Welcome back to week 3 of this course on physical medicine and rehabilitation in sports. I am Colonel Dr. Anup Krishnan, and I'll be taking you through lecture 5 of week 3, which deals with advances in diagnostic technologies in sports injuries. We have talked about diagnostic technologies in sports injuries. Now, let's take a look at what is um, newer technology and what is coming in the future. I'll be discussing this lecture as per the following outline: introduction, objectives, current available modalities, the newer modalities. We'll talk about the future trends and we'll conclude with a take home message. I do not have to stress upon the importance of accurate and early diagnosis in sports injuries. We have been stressing upon this importance since the past 2 weeks. The diagnostic techniques or technology has evolved from traditional methods to high tech solutions. There is a big role for advanced diagnostics in optimizing treatment, rehabilitation, and injury prevention. Objectives of this lecture: to understand the various advanced diagnostic methods which are used in sports medicine, to explore the benefits, applications, and limitations of each technology, to discuss the emerging trends and future developments in sports injury diagnostics. The various imaging modalities which are used currently in sports medicine are X-rays, used for fracture and joint abnormalities. It's cost effective and it is widely available. MRI is the gold standard for soft tissue injuries, detects ligament, tendon, muscle damage, but is slightly expensive. CT scan, high resolution imaging of complex fractures and bony stress injuries can be picked up by CT scan. Musculoskeletal ultrasound, used for real-time imaging of tendons, ligaments, and for guided injections. MSK ultrasound can be portable and dynamic. Let's start with the other modalities. Surface EMG or SEMG basically uses electrodes or patches which can be applied to the skin. It may also use needle electrodes which has to be put into the muscle. Surface electrodes are non-invasive, needle electrodes are invasive. So commonly used technique is surface electrodes. Measures the electrical activity in muscles to assess neuromuscular function. Helps to detect muscle imbalances, fatigue, and activation patterns. It has got widespread applications in rehabilitation, performance assessment, and injury prevention. Isokinetic dynamometry. We discussed it a bit in the last lecture. Isokinetic dynamometry is the gold standard for muscle strength analysis. It measures muscle strength, measures muscle endurance, measures power under controlled speeds. More importantly, it tells you what are the muscle imbalances across the joints, and it can also tell you how the rehabilitation is progressing. You can also use an isokinetic dynamometer for rehabilitation purposes. You can rehab the patient or using an isokinetic dynamometer. This machine provides objective data on torque, power, and fatigue resistance of the muscles. Motion capture systems. We talked about 2D motion and 3D motion. Three-dimensional motion capture system is the latest. It uses three-dimensional motion analysis to assess movement biomechanics. It helps to detect movement deficiencies that may contribute to injuries, and it is used in return to play decisions and technique refined. I'll tell you the basic reason why 2D and 3D motion capture systems are necessary. Because the human eye has got a particular speed or frames per second beyond which it cannot detect motion. However, the camera systems of these high speed 3D motion analysis systems start at 300 frames per second. And there are several movements which the human eye cannot even detect because of a technical fault or a technical limitation. So that is why 3D motion analysis is very, very important. Force plate. How do you land when you jump? How do you observe the forces? What are the forces of the various joints? All these can be measured by these force plates. It measures ground reaction forces during movements like jumping and landing. Assesses the balance, limb asymmetry, and the injury risk. It is used for athlete monitoring, rehabilitation, and for performance analysis. Generally, force plate analysis is used along with a 3D motion analysis. Wearable sensors and GPS tracking. Very useful to monitor movement patterns, very useful to monitor the total workload and the fatigue of the athlete. It prevents overuse injuries by tracking the training loads, and it provides real-time data to coaches and medical staff. The athlete is wearing these sensors. The coach may be sitting in another city, but he can monitor the athlete in real time. Thermography. It uses infrared imaging to detect temperature changes in muscles and joints. Helps to identify inflammation and overuse injuries very early. It is non-invasive, it is radiation-free, and provides quick assessments. Blood biomarkers. These are indirect markers for injury assessment. They detect markers of muscle damage, inflammation, and fatigue in the blood. Help in planning recovery, help in monitoring recovery, and help in certification of readiness to return to sport. Can be used for personalized training load management. Functional movement screening, FMS, evaluates movement patterns to identify injury risks. It has got several exercises and tests which is to be done. And it is useful for prevention of injuries and for planning of rehabilitation. Tools for diagnosis of concussion. SCAT-6, which is a standardized assessment for sports concussion. King-David Twist evaluates visual tracking and cognitive function, which is used for, again, testing the severity of concussion in sports like boxing. Balance error scoring system assesses postural stability post concussion. And nowadays, advanced MRI techniques have come in for detecting brain injuries. AI in sports medicine. There are several AI driven models which have been developed for injury risk prediction. Machine learning algorithms for gait and movement analysis have been developed based upon the countless gait and movement analysis which has been done so far on patients and athletes. AI assisted image interpretation is now being used for faster and more accurate diagnosis in imaging technology. Rehabilitation is using virtual reality based functional testing for neuromuscular testing, training, and rehabilitation. The VR based systems offer a simulated environment for balance and coordination training in a safe manner, enhances cognitive motor integration and rehabilitation engagement. Biomechanical assessments in sports injuries uses various kinematic and kinetic analysis to evaluate joint function. Helps to identify improper mechanics which contribute to injuries, and helps in technique modification and performance enhancement. Pressure mapping systems analyzes how your foot pressure is being distributed during gait and during running. Helps to identify faulty mechanics that contribute to injuries, and can be used for designing custom orthotics and for footwear modifications. EEG, electroencephalography in sports injuries. EEG monitors the brain activity. It can be used for monitoring brain activity post concussion. Assesses cognitive performance, reaction time, and neural recovery. Can be used in neurorehabilitation and return to play decisions. Tendon and ligament stiffness testing uses something called elastography to assess tissue elasticity and stiffness. It is helpful for early detection of tendinopathy and ligament injuries, and monitors progression of soft tissue healing. Gait analysis systems, basically a type of three-dimensional motion analysis systems which evaluates gait and walking and running biomechanics to detect asymmetries. Helps in correcting improper loading patterns, and is used in injury prevention and rehabilitation. Advanced ultrasound techniques such as elastography measures muscle and tendon stiffness. Doppler ultrasound is used to assess vascular injuries and inflammation. And dynamic imaging guides injections and assesses joint stability in real time. Genetic testing in sports medicine, now coming up in a big way, and it is used to identify genetic predisposition to injuries like tendon ruptures. Helps to personalize training and recovery programs, used in optimizing athlete performance and endurance potential. However, more importantly, it can be used in talent identification and talent development by identifying specific genes which are responsible for muscle performance and endurance performance. Future trends in sports injury diagnostics. AI and machine learning integration is coming up in a big way into all diagnostic machines. We are trying to develop portable real-time diagnostic devices for early diagnosis of sports injuries. And advancements in regenerative medicine and imaging techniques are taking place every day. The challenges and limitations: high costs of advanced diagnostic tools, and it is not available everywhere. There is a need for specialized training to interpret data accurately. And there is standardization issues in newer technologies. Clinical implications. These technologies improve accuracy in sports injury diagnosis, helps in faster rehabilitation with precise monitoring, enhances athlete performance through individualized assessments. Take home message: advanced diagnostics are revolutionizing sports medicine. Early detection and personalized rehabilitation enhances outcomes for athletes. And continuous innovation is driving better athlete care and performance optimization. There are very exciting times coming up for these modalities for diagnosis and treatment in sports medicine. These are the references I have used for preparing this lecture, ladies and gentlemen. With this, we come to the end of week 3. There will be an assessment which you will have to submit within the stipulated period. Thank you for your time and for your listening. Thank you and Jai Hind.